Normal GFR rate. Option A, 90 milliliters per minute. Option B, 125 milliliters per minute. Option C, 170 milliliters per minute. Option D, 200 milliliters per minute. The answer is option B, 125 milliliters per minute. Glomerular filtration rate is the volume of fluid filtered from the renal glomerular capillaries into the Bowman's capsule per unit time. The purpose of peritoneal dialysis is. Options are, Option A, clean the peritoneal cavity. Option B, remove the toxins from the body. Option C, re-establish kidney function. Option D, provide medication. The answer is option B, remove toxins from the body. Peritoneal dialysis is a type of dialysis which uses the peritoneum in a person's abdomen as the membrane through which fluid and dissolved substances are exchanged with the blood. It is used to remove excess fluid, correct electrolyte problems, and remove toxins in those with kidney failure. According to Erikson's psychosocial theory, what is the developmental task of the toddler? Option A, autonomy versus shame and doubt. Option B, trust versus mistrust. Option C, industry versus inferiority. Option D, initiative versus guilt. The answer is option A, autonomy versus shame and doubt. Sudden voluntary repetitive movements of voluntary muscle in children is termed as. Option A, pica. Option B, Tourette syndrome. Option C, echolalia. Option D, echopraxia. The answer is option B, Tourette syndrome. Tourette syndrome is a disorder that involves repetitive movements or unwanted sounds that can't be easily controlled. Option A, pica, is an eating disorder in which a child eats things not usually considered food. Young kids often put non-food items like grass, toys. Option C, echolalia is a meaningless repetition of words or phrases heard by someone. Option D, echopraxia is the involuntary repetition or imitation of another person's actions. The common type of fracture which found in children is. Option A, multiple fracture. Option B, green stick fracture. Option C, pathological fracture. Option D, hairline fracture. The answer is option B, green stick fracture. A green stick fracture occurs when a bone bends and cracks, instead of breaking completely into separate pieces. The nurse explained to the mother of a neonate diagnosed with erythroblastosis fetalis that the exchange transfusion is necessary to prevent damage to. Option A, liver. Option B, lungs. Option C, kidneys. Option D, brain. Answer option D, brain. Erythroblastosis fetalis is an alloimmune condition that develops in a fetus at or around birth, when the Ig molecules produced by the mother pass through the placenta. Among these antibodies are some which attack antigens on the red blood cells in the fetal circulation, breaking down and destroying the cells. The fetus can develop reticulocytosis and anemia. When caring for a client in hemorrhagic shock, how should the nurse position the client? A, flat in bed with legs elevated. B, flat in bed. C, Trendelenburg position. D, semi-sitting position. The answer is option A, flat in bed with legs elevated. The shock position is flat in bed with the legs elevated to increase venous return. An adult woman has been in an automobile accident. She sustained numerous lacerations, a fractured tibia set by closed reduction, and a mild concussion. She has no apparent renal injuries and is conscious. An indwelling catheter is inserted for which of the following purposes? Option A, to measure urine flow as an indicator of shock. Option B, to prevent contamination of her cast. Option C, for her comfort. Option D, to prevent renal complications. The correct answer is option A, to measure urine flow as an indicator of shock. Is caring for a woman who had ACVA and has right-sided hemiplegia. Which action is least appropriate? The options are A, performing roam exercises when bathing the client. B, changing the client's position every 2 hours. C, positioning the client supine and pulling the bed sheets tightly across her feet. D, placing the client in the prone position for 1 hour 3 times a day. The correct answer is option C, positioning the client supine and pulling the bed sheets tightly across her feet. The bed sheets should not be drawn tightly over the feet because this action might cause food drop, especially with the client in the supine position. The client has just returned to the nursing care unit following a hemorrhoidectomy. What order should the nurse expect? The options are A sitz bath stat and 4th hourly. B. Warm compresses to the surgical area. C. A hot water bottle to the surgical area. D. An ice pack to the surgical area. The correct answer is option D, an ice pack to the surgical area. The client will have an ice pack applied to the surgical area on the day of surgery. Sitz baths will probably be ordered for the following day.